So today we are reporting 80 new cases in British Columbia of COVID-19 in the last 24 hours, bringing the total since the beginning of the pandemic to 4,825 COVID-19 infections. By health authority, 1,526 are in Vancouver Coastal Health, 2,533 are in Fraser Health, 159 are in Vancouver Island Health Authority, 411 were in the interior, and 121 were in Northern Health. 75 infections were among people who came from outside of Canada. Currently, we have 780 active cases, of whom 11 are hospitalized and 4 are in critical care. 2,574 people are at this time under active public health monitoring. We are sad to report 2 new deaths in the Fraser Health Authority, bringing the total to 200 deaths in British Columbia due to COVID-19. Our sincere condolences to all those who have lost friends and loved ones during the COVID pandemic, and in particular to those who lost loved ones recently. At this time, 3,845 people are fully recovered from their COVID-19 infection. There are no new healthcare outbreaks reported today. There are, however, 9 active outbreaks being monitored by the health authorities in our healthcare system. 8 of those are in long-term care facilities or in assisted living, and 1 is in acute care. Among community outbreaks, there has been 1 new community outbreak with 9 confirmed cases of COVID-19 at Loblaws reported in the Fraser Health Authority. Fraser Health Public Health teams are on-site managing this cluster. In Haida Gwaii, there is an outbreak that's being actively monitored, and the update on that outbreak is that everyone in that cluster is at this time considered fully recovered. Public Health will continue to monitor for potential new infections until the outbreak is declared over. Health authorities continue to issue community exposure alerts for a number of locations and flights coming into and out of BC. Please do check these websites regularly to make sure that you are up to date on any potential exposures. So what do today's numbers tell us? We do continue to see new infections in British Columbia. The number at this time is relatively stable, but we are continuing to see them. The number of people in hospital and intensive care units remain low. We are seeing a small increase in infections in the 40 to 60 year age group. We are carefully monitoring this trend because we know that the risk of severe illness goes up with age. And the 2 new deaths in long-term care facility, of course, reflect the vulnerability of this population to severe disease from COVID-19. The COVID-19 pandemic has really been hard for many of us. We have seen in this year's population health survey from British Columbians that their mental health and sometimes their economic well-being is really being affected by the COVID pandemic. We have had to change many things and learn new ways to safely live our lives. Yet British Columbians have shown incredible resilience and caring and fortitude in this pandemic. In addition to COVID-19, in recent weeks, parts of the province have also had to manage forest fires. And COVID-19 brings an added complexity to that, especially if you have to self-isolate, especially if you're at risk for severe disease. I can only imagine how hard that must be. And I do want to assure you that public health is working with emergency management to support you at these difficult times. I would like to talk a little bit about gatherings. We are actually fortunate in British Columbia to have some of the best public health experts in the world working in our health authorities and in our universities. And not only are they doing their own research, they're constantly reviewing research and data from both around the world, but also our local experience to bring that information to bear on the decisions that we make coming up. You may not know them, you may not see them regularly, but they are tirelessly working to keep all of us safe. And one of the things that they're finding is that regardless of where we may be in our province and what we may be doing, we have seen that indoor gatherings that are encouraging very close proximity tend to be an important source of transmission. The 2 notable things about these gatherings are crowding and, in some cases, alcohol. These are often small outdoor gatherings that are different from controlled settings such as an office or a classroom, where you know who is in the room and you can more easily take precautions. So that is why we're asking you to keep your group small, to spend time with people you know, and to always stay at home when you are sick. By doing this, you are supporting not only the public health teams, but your family, your friends, and your community to stay safe. While we still have much to learn about COVID-19, we do know that by continually monitoring for clusters, quickly managing new cases, and containing the spread, we can protect those most vulnerable and keep ourselves and our loved ones safe. Please do understand the risk and be an influencer. Support your friends and family to do the right thing. And we all recognize that this COVID-19 hasn't been easy, but we can be assured that by continuing to work together, we will get through this. And I'd like to thank you again for all you are doing.